Okay, I think we should be recording. I'm Caitlin Riley, and we're doing the response discussion for the informed consent, and we're going to be responding to the article discussion video.
I'm Devin on this. So.
The first thing that I found interesting was, so the girl that we watched, her she was working in the Navy, and these girls were having to get like a procedure done to test for cervical cancer, but it must have been like an intense procedure because the girls either came in not knowing like what kind of procedure they were getting done, or when they found out they didn't show up. And the fact that like they didn't know kind of shocked me, just because you would think with like a government branch that they would be like informing everybody, but I mean, I guess not.
Yeah, it seems like the patients were informed once they got there, and so they got the informed consent, but they got it pretty late. And I actually think it's pretty interesting and pretty smart, because it is in the best interest for the patients to get the procedure done, to find out they have the cancer or not and stuff like that. So if that's what it takes to get them there, I guess that's not a bad idea, but it isn't very morally correct, I guess. So I kind of like the way they did it, though, to be honest.
Yeah, like that's my biggest issue, is I can see both sides. Like I feel like you should give it a little bit earlier, just so that way they can think about it more. But also, like, if it's that important, like you're testing for cancer, like it might be best to just tell them right when they get there, so that way they can't back out, because it's for their benefit.
Yeah, definitely.
And then I also wanted to talk about how the provider should not cherry pick what information to give. So like in her case, like I think it's better for them to tell the entire information, whether it's right before they do it or way before they do it, rather than just telling them like what they want to hear, and like, or leaving out risks or things like that, because that can also influence somebody's decision.
Yeah, the risks and benefits are definitely a necessity. Probably more the risk, because that could be detrimental to one's health if they don't really understand what could happen to them. But I think the physician needs to make sure that the patient understands fully what's like what could happen to them. So I think that's very important, and that's the job of the physician, because not every patient is as intelligent in the medical aspect of life in comparison to the physician. So you might need to dummy it down sometimes to make sure they really understand it.
Yeah. And then she also like pointed out from the Walker article, she says that she thinks Walker would agree with her in the fact that they should know the care that they're going to be given prior. And so that's where I'm torn, because I agree, but I also don't agree. Yeah, I mean, I always think patients should be informed, which I mean they were, but it was really late. So it's a tough
Yeah, it was, but I feel like I mean, it's important, because the physicians were doing what was in the best interest of the patients. It's not like they were doing it trying to just make them do the procedure for money. So I kind of like that aspect of it, but they should definitely be informed ahead of time. So that's all I have to say on that.
I would say, yeah, I went over all of my points, but
Perfect.
yeah.